The question is, what is the biggest challenge for people's health today? This is going to be a little long answer, but it's a very important question. So let me try and say what I think. The biggest challenge is a system of medical care that is broken, in many cases corrupt, and in many cases totally inefficient. But even bigger than that challenge is a materialistic model that looks at the human body as a noun, as a structure, when in fact your body is a verb. It's an activity, and this activity is regulated by eating, breathing, digestion, metabolism, elimination, the world of sensory experience, sound, touch, sight, taste, and smell, your inner world of thoughts, feelings, emotions, desires, memories, imagination, and creativity. This is what it means to be a living organism, particularly a human organism. And yet our system programs our physicians into this materialistic model, which only looks at pharmaceutical or surgical approaches. In other words, if you take this molecule, or if you take this dose of radiation, or if you get this surgery, then you'll be well. Well, in many cases, that will indeed correct the problem, not correct the problem, but take away the symptoms, but it will not address the root origins of the problem. And so today we are understanding lifestyle diseases. How you think, how you feel, how you behave, how you eat, the quality of your sleep, exercise, the amount of weight you carry on yourself. These are the principal determinants of whether we get illness or not. In my book Superbrain with Dr. Rudy Tanzi, we talk about how you can actually change the structure of your brain through your consciousness. And that holds true of your genes. 500 genes that are responsible for things like inflammation, coronary disease, heart disease, other kinds of heart disease, inflammatory disorders, many chronic illnesses, asthma, etc. These genes can be upregulated or downregulated based on how you live your life. But we are fighting a huge medical industrial complex, and also our population, the world in general, is bamboozled by the idea that there's a quick fix. And all of our healthcare reform is not really healthcare reform, it's insurance reform. And it only actually in many ways perpetuates the problem of unnecessary surgeries, unnecessary diagnostic tests, and unnecessary procedures, and unnecessary pharmaceuticals, because it's known that 80% of the pharmaceuticals that we use are of optional or marginal benefit, which means if you didn't use them, it wouldn't make a bit of a difference to your life except save you some money and possibly from side effects. Have you ever watched the commercials on pharmaceuticals? They start with feeling tired, then they move to impotence, and they finally move to death. Why would you take something that causes you fatigue, impotence, and death? And almost every drug that is advertised tells you that beware of that. So we need to rethink our way of thinking about health and well-being. And as I've said in a different post, you have to think of your physical health, your relationships, your emotions, your career, your financial well-being, your community well-being, and your social engagement, your exercise, your sleep, and your eating habits to actually be healthy. The biggest challenge is it seems so obvious, but nobody's doing it.